Hello, and welcome to the CDBG Home 2627 Annual Action Plan Public Forum Sessions, March 25th, 2026. My name is Vanessa Baker Latimer, and I'm the Housing Coordinator from the City of Ames. And it's my pleasure to present this presentation to you to learn more about our upcoming Community Development Block Grant and Home programs. We're going to start off with our agenda. Our action plan agenda for 2627 is we're going to do a basic overview of the CDBG home and home art programs. We're going to review our consolidated planning requirements. We're going to do an overview of the 5-year goals and priorities for 24-29. We're going to also propose our 26-27 annual action plan projects, and then share with you a tentative timeline for next steps for you to have the opportunity to engage in the process. Okay, basic overview of our programs. Community Development Block Grant is normally called CDBG, and our Home Investment Program is known as HOME. The program was created in part as part of the Housing and Community Development Act of 1974 as amended. It's what they call a formula grant. Congress appropriates funds annually to states and localities called entitlements or grantees. So that is what the city is normally known as an entitlement or grantee. The Community Development Block Grant Program is one of the longest running programs administered by the Department of Housing and Urban Development. And so when they look at determining formulas across the country, they look at the inadequacies of each jurisdiction's housing supply, its incident of poverty, its physical distress, and other factors. The primary purpose of the Community Development Block Grant Program is the development of viable urban neighborhoods by providing decent housing, a suitable living environment, and expanded economic opportunities, principally for persons of low and very low income. CDBG is a very important tool for helping local governments tackle serious challenges that faces our communities. It has 3 national objectives. One is low and moderate. And under the low and moderate tab, you can do such programming that benefits a specific area. You can do it that benefits housing. You can do it that benefits a limited clientele, which means more concentrated, like homeless individuals or seniors or a specific population. That's why it's limited clientele. And then it also can be used to help create jobs. Now, we have not in the past used our CDBG funds to do job creation because the city does a good job with working with the chamber and our own economic development groups to bring those dollars to our community. So we try to concentrate on the other areas that are not being funded with CDBG. The second national objective, you can also use CDBG funds to do slum and blight. You can do an area basis or spot basis, or what they used to call back in the day urban renewal, which doesn't really exist anymore. And also you can use it for urgent need. And just so you know that we have used our CDBG funds on all 3 of these categories. Slum and blight, where we've gone in to some of our vital neighborhoods where we find abandoned, deteriorated housing that is probably a hazard to the neighborhood. We've gone in and torn down those properties and created more viable housing. And then urgent need is where we've used these funds in those years where we had serious flooding that took out some of our residential neighborhoods, where we've gone in and bought those properties up and demolished those homes as part of that urgent need. Okay, low and moderate income, LMI, that is the term for low and moderate income. The low and moderate objective is very important objective of the 3 national objectives I just talked about because it's the primary goal of the CDBG program. At least 70% of all the expenditures that we have to spend over a 1 to 3 year consecutive period must support activities that comply with the LMI national objective. The housing objective is the only LMI national objective based on household assistance. And then qualifying households' income is based on not exceeding 80% of the Ames Metropolitan Statistical Area, what they call AMS, of the county or non-metro state. I know I said a lot, but I'll explain more about it on the next slide. The median income, the determined income caps are determined by HUD. So let's talk about that. So for 2025, the medium income limits for AIMS as established by HUD is based on four categories: those at 80% or less, those at 60% or less, those at 50% or less, and those at 30% or less. We've tried to do a lot of our programs that meet all four categories. Like for 80% or less, the median income for a family size of four is 99,100 gross per year. So if you're a family of four and you're looking to qualify for one of our programs, your household income would have to be at or below that amount to qualify. And a lot of the people at the top of the income at 80% are usually the people that can afford to participate in our down payment and closing cost assistance program. And then those at 60, 50, and 30, those programs is where we do our housing rehab programs. We do our renter affordability program, where we help people with deposits and first month's rent and utility assistance and so forth. As you can see, those income levels are a little lower than the 80%. So for example, at 50%, a four-person household, your income has to be at $61,950 gross per year. So the area median income for the entire city of Ames is $123,900 per year. These income changes every year. So this 25 income limit was effective June 1st of 2025, and they're subject to change every year. So we anticipate that the 2026 numbers will be coming up this coming June. Also, HUD also designates our low and moderate income census tracts. We have over 13 census tracts in our community. And as you can see on this map, those that are highlighted are the ones that are designated by HUD. And what we mean by low income census tracts is that at least 51% of the households in that census tract are considered to be LMI, which means they're at that 80, 50, 60, or 30% of the income limits that we just talked about. And so these are areas that we can go in and benefit the entire neighborhood, regardless of whether or not everyone in the neighborhood is LMI. So it benefits everyone. So a lot of times we do a lot of our infrastructure projects in our census tracts, where we replace sidewalks, we replace water and sewer lines, we do handicap accessibility to get people from across the street safely. We can do parks and those type of projects in the census tract, and it benefits the entire census tract because that census tract has at least 51% of the households that are considered LMI. Also, we have what we call our State Avenue Neighborhood Revitalization Strategic Area. And this is an area where we had to actually qualify with HUD because we own a piece of land out there called it's the Baker subdivision. It was called the old Ames Middle School site. And we were able to purchase that site back in 2015 to develop it into a subdivision for housing for both low and moderate income and market rate housing. And in order to benefit that entire tract, we had to make an application to become a neighborhood revitalization strategy area. And so this is the only census tract that we have in the Ames that meets this qualification, that allows us to do a variety of projects in this particular census tract. Now, let's talk about what some of the CDBG eligible activities are. You can use CDBG funds related to housing programs, related to public facilities, related to public service, and related to economic development. And over the years, we have done a little bit of all of that, except we have, again, as I mentioned earlier, we have not spent that much time doing economic development because that's really being taken care of other funding. And so we try to make sure our CDBG funds are really providing a gap and not duplicating dollars that are already being utilized in the community. So let's talk about activities related to housing. We can use the funds to do like housing rehabilitation, where you can get a grant or a loan if you need a new water heater, new furnace, new roof, new windows, things like that. We can also use it to help with home ownership assistance using down payment and closing cost assistance. We can also use it to help do lead abatement and lead testing for homes. Also, for radon too. That's an important uh, project that we can use to help reduce the lead gas. I mean, the radon gases in houses as well. We can use it to buy properties. Disposition of properties, like when we buy a piece of land and we may have to maintain it for a while, that covers those funds cover that too. And then we can use it for code enforcement, for those houses that are in disrepair and may need to be brought back up to code. And we can also use this to do any type of historic preservation. We do have historic preservation designation in our community, and we can go ahead and use the funds for that as well. Let's talk about activities related to public facilities. Those activities consider things like infrastructure, as I mentioned earlier. We can use it to do streets, sidewalks, water and sewer. Also, neighborhood facilities. We can put in parks and playgrounds and recreational facilities. We've done a little bit of both of those things. We can use it for special needs population, like homeless shelters or group homes. We can use it to clearance and demolition, and we can do it for special assessments. So, again, this is another category we could use our funds for. And now, activities related to public service. Those include activities helping people with health care and substance abuse counseling types of programs, child care, job training, employment services, uh, crime prevention, services for seniors. This particular program has what they call a program cap, which means HUD limits how much of our funds can go towards this type of activity. Now, the public service that we can help that has a cap on it, it has to be a new service or a quantifiable increase in the level of service beyond which is being provided in the community or the local government being raised. And this are requirements intended to prevent the substitution of using CDBG funds to replace programs that's um, already being financed by public services by the city. Like one of the programs, a big program that we have in the city is our asset dollars. Well, we use asset dollars to fund a lot of our human service agencies. That would be one area that CDBG funds could not go in and substitute those dollars, because those asset dollars have been in our community for since 1970. So that would be one. That actually is more than we get in CDBG funds. So that's where this cap would not benefit using CDBG funds for. Now, again, there are several programs that we have that have a cap. Our planning and administration, we cannot use more than 20% of our CDBG funds to go towards planning and administration. And again, that public service cap is 15%. And there can be some special economic development activities that have kind of a cap. But again, since we do not implement any economic development activities, we just kind of go with the 20 and the 15%. And here's an example of that calculation. Like our annual entitlement for 25-26 was $552,927. So a 20%, the maximum that we could use that for administration, is just over $110,000. And then for our public services program, that cap is 15%. So 15% of that 552,927 means the maximum amount of dollars that we could use for the various public service activities is limited to just over $82,000. And the question sometimes is, are public service activities ever exempt from the cap? And the answer is no. So just want people to know when they say, well, how come you're not funding the deposit assistance program more? But this is because those types of programs have a funding cap. Okay, now we're going to go over to our home program. The home program was created as part of the National Affordable Housing Act of 1990. It is also a formula grant like CDBG. It's also Congress appropriates the funds annually to states and localities. Under the home program, the city of Ames is considered a participating jurisdiction, which we're known as PJs. So it's different acronyms based on funding. And I know they sound a little funny, but that's just how HUD set them up. And the home program is also one of the largest federal programs administered by HUD, and it's designed exclusively to create affordable housing for low and moderate income households. And we'll talk about that a little bit here. So, home is focused on low income households. Just like 100% of the home dollars can help people at 80% or less of the median family income limits. Those are the income limits that I went over under the CDBG program. They are the same. And then the lower income levels, they have rules about what percent can be used for rental assistance or household income at 60%. And there's a lot of rules on 20% of the funds can only be used on rental projects if you're building 5 or more homes. And I know that's a lot. And sometimes it's hard to kind of explain that by just reading this particular thing. So we'll try to use some activities that we do to make a little bit more sense. The home program has 4 programs and one that you can use the funds for. You can also use home funds to do homeowner rehab. You can use the home funds for home buyer new construction or down payment assistance. Now, you can't do new construction with CDBG, but you can under home. You can also use home dollars to develop new rental housing units or rehab rental housing complexes, which you can't do under CDBG. And then you can also use it for rental subsidy on what they call tenant-based rental assistance that works very similar to the Section 8 program, where you pay a certain percent of your income, and the government, through these programs, can subsidize the gap to make up 100% of the rent. Now, let's talk about some of the eligible costs under the home program. It can cover like hard costs, like for new construction, rehab, or conversion of housing from single family to multifamily or multifamily back to single family. It can cover the cost of demolition. It can cover the cost of relocation. Say we had to purchase a rental complex that was in disarray, but in order to repair it, we have to move the families out. So it pays for us to temporarily relocate families until that unit has been repaired. You can also use it for acquisition of vacant land, improved land, but this construction has to begin within certain time frames. And so it goes for all those various types of eligible cost. Now, home program distinguishes between units that have assistance and home funds that have not. So if you already have a program that has home dollars in it, then you may not be able to add any additional home dollars to it. And one good thing about the home program, it can be spent on mixed income projects. So say if you have a 30 complex rental housing unit, it can help both people who are at the income limits and those who are above the income limit. So it can be used for what they call those mixed income projects. The home rule program also have affordability periods, which means that when we invest our dollars into a project, it establishes a time frame that project would have to remain affordable or for whatever it's used for a certain period of time. So the amount of money you put in, if you put in a lot of money, it's going to be a lot of period of time for affordability period. If it's a small amount, it's a shorter period of time. Not like CDBG. Home has these affordability prices. Some of them times can go through 20 to 30 years. Sometimes some of them can be 50 years. Again, it depends on how much home dollars you invest in that particular project. Again, the home program for administration, it allows us, the PJ, to charge for administrative costs so that we can get the programs administered. And also our administrative has a cap, just like CDBG. Only 10% of our grant dollars can go towards program administration. And then there is also a requirement that you have to set aside dollars for what they call a CHODO operation. And CHODO stands for Community Housing Development Organization. There are very few in the state. We do not have a CHODO in the Ames area. It's an organization that has been built up over time that can go in and implement programs in certain neighborhoods. We do not have one in Ames at this time. And then, so we have to set aside a certain percent of our funds for any designated CHODOs that we may have in our community. And then home also has a match requirement, which is different from CDBG. It doesn't have a match. We as a PJ must match 25% of our home funds towards any project cost. And it has to be a permanent match. It can't just be we match it for some of the dollars. It's a permanent contribution. So we also have to track that whatever project we do with our home dollars, we have to match it with non-home dollars, whether we use city dollars, various types of city dollars that doesn't count as any federal or state dollars can be used as match. Again, at least 15% of the home funds must be set aside again for the CHODO, the Community Housing Development Organization. And to qualify for a CHODO, you must meet certain requirements regarding legal status, organization structure, capacity, and experience. And currently, we do not have a CHODO established in our community. So let's talk a little bit about what the similarities are between CDBG and home. Well, the benefits are used, you can use them concurrently. It stretches your resources when you can use them concurrently. And each program addresses activities that the other one cannot. However, when you combine them, the one with the most restrictive rules, you have to use those rules first. And home has more restricted rules than CDBG. So when we combine them, we have to go with the most restrictive rules. Now, I've talked a lot about home and CDBG, but overall, there are a lot of other federal requirements that have to be met in order to implement any programs that we do, whether it's CDBG home. And this just lists a few of them. So we have to make sure that we're doing fair housing and equal opportunity, that we're addressing handicap accessibility. If there's flood insurance, you can't do anything in the floodway. If they're lead-based paint, or if you have debarred contractors, or if you have labor standards, you have to pay a certain labor rate to those individuals. And then you have to meet acquisition and relocation guidelines. So there's a lot of other federal requirements that have to be implemented when we do a program with both CDBG and home. And a large component of the CDBG and home is our citizen participation component. So we as entitlements and PJs must develop a plan that we encourage citizen participation of residents, whether they're primarily low and moderate income or low and moderate income neighborhoods, and whether they're using CDBG or home funds. And we give them the opportunity to participate in our public forums and in our public hearings and all of our processes. Also, we try to identify the needs of non-English speaking residents so they can be part of the process as well. So that's one of the reasons why we have our public forums and our public hearings, because we want that citizen participation to be able to give us feedback and participate in how we're going to utilize those funds in our community. And just to give you an idea for the statewide allocations for 2025, I just think it's always interesting to share how much money has been given to the state of Iowa. And so you can see all the entitlement communities here on this chart. And the state of Iowa, the Department of Economic Development and Iowa Finance Authority, they get the largest CDBG allotment, which is over $24 million. They get over $7 million of home dollars. They get about over $3 million of ESG, which is Emergency Shelter Grant for homeless agencies. And Hopwa, which is housing for persons with AIDS, they just get over $1 million. And then they get about over $3 million, what they call for housing trust programming. And as you can see, there's Ames, Cedar Rapids, Cedar Falls, Council Bluffs, Davenport, Des Moines, Dubuque, Iowa City, Polk City, Sioux City, Waterloo, and West Des Moines. Those are all the entitlement communities in the state of Iowa. So we all get a piece of the funding that comes to the state. And again, it's based on population. It's based on a lot of demographic information. And HUD puts into a formula and determines who gets how much of the pot that comes to the state of Iowa. Also, I always like to go over that the city, for a CDBG program, we became an entitlement community back in 2004, where I kind of show the amount of CDBG we've gotten over the years. Back in 2004, our first allocation, we got just over $589,000. And then that 20% of that, just over $117,000 went to administration, and over $471,000 went for programming. So as you can see over the years, our CDBG fluctuates from year to year, starting in 2004 all the way through today to 2025, where we just this past year received just over $552,000, and 110% of that went to admin. So we don't know from year to year until HUD announces it how much CDBG funds we're going to get. But as you can see, it does fluctuate annually. So that affects what we can do and how much we can do, depending on how much allocation. So for right now, we're waiting to find out what our 26-27 allocation would be. Same thing with our home. As I mentioned earlier, we became a home entitlement back in 2018-19. And yes, we got $750,000 in our first allocation, of which 10% of that, $75,000, could be used for admin, and just over $562,000 could be used for programming. And as you can see, it has significantly gone down over the years. It finally came back up this past year in 2025, where we got just over $278,000 of home funds, of which about $27,000 of that could be used for admin. And again, we're still waiting on our 26-27 notification of how much we're going to receive. And these amounts does not include the set aside, the 15% set aside that's required if we had a CHODO organization. So also, as part of the when we had the COVID years, we got a special allocation of what they call Home ARP. And that was part of the American Rescue Plan Act of 2021. And Congress appropriated about $1 billion for affordable housing services, non-congregate shelter to individuals experiencing homelessness and other vulnerable populations. And these were allocated by formula again to qualified jurisdictions, and the city of Ames qualified for a one-time special allocation of home op programming. And the city was allocated just over $1.2 million. And so we submitted our plan back in 2023. It finally got approved, and it's again going to be used for specific populations, and all of the funds must be spent by 2030. And so just to give you an idea, we are planning to use our money after we take off the 15% that goes towards administration for non-congregate shelter. So that can be used to acquire or develop shelter for homeless individuals, veterans, where they can have a place to stay temporarily until they get back to their feet. And that means they have their own private bedroom and bathroom in their particular unit. And they don't share bathroom or bedroom areas like most other shelters may have. That's why it's called non-congregate sheltering. And so 100% of our funds is going to go to that. So we're not sure how many facilities we're going to be able to utilize using our home funds. It may be 3, it may be 1, but we're working on trying to find the best use of a non-congregate shelter that's going to benefit the entire city. And so again, we can use 15% of that for our admin. Now, I'm going to quickly go through our consolidated plan because I want you to understand how we get from the action plan. We actually start with our consolidated plan. The consolidated plan is a document and a strategy that HUD requires all jurisdictions to utilize in when you get your formula from them. And it has 3 components. There's a strategic plan where we identify, prioritize, and address the general needs of low and moderate income persons for housing, jobs, or services. And we can do that over a 3 or 5 year period. For AIMS, we do it over a 5-year period. And then we have to come up, we work with the public, we work with our city council, and we determine what our goals and priorities are going to be for a 5-year period. So once we determine the goals and the priorities, which I'll go over here in a moment, then we create the action plan. And that's where we take those goals and priorities and we create projects that meet those goals and priorities. And then we implement those during the year. And then the last component is called our Consolidated Performance and Evaluation Report, short for CAPER. That's when we also report how we were able to use those project activities, what we spending on, what we were able to do, how much it cost, who it benefited. So those are the components of the consolidated plan. So it must fall into 2 categories. We have to talk about the goals and priorities that's going to meet low and moderate income residents of the community. And then we can talk about goals and priorities, for those residents who are not low and moderate income in the community. So those are the 2 categories. So for our 24-29 priorities for low and moderate income, we as a community said we were going to utilize and leverage our CDBG and home funds through private, nonprofit, public partnerships to create expandable, sustainable, affordable housing. We're going to increase supply of single-family and multifamily housing in not only our neighborhood revitalization area, but citywide as well. We're going to hopefully reduce the cost burden for low-income households so they can access or maintain rental housing citywide. And we're going to increase the affordability, the quality and density of available owner housing for homeowners citywide. And we can do that annually, or we can do it every other year. It all happens within that 5-year period. And what we talked about, our strategy for non-low-income housing persons, is, again, we're going to leverage our CDBG and home funds through private, nonprofit, and public partnerships to create sustainable, expandable housing for non-low-income housing through integrated, affordable, and market rate residential developments where we want to create subdivisions that house both low and moderate and market rate housing, so we don't just create lopsided housing. It has benefits for both. We're going to use it to remove slum and blight in deteriorated areas and reuse that into new housing where we have housing that's been abandoned, like I talked about earlier, to support code enforcement, to keep our neighborhoods safe from blighted structures. And then we're also, hopefully we won't have to be using this to do floodplain or hazarded areas again, but if we need to, we would use the funds for that as well. So again, as we go through the process for our annual action plan, there are several things that HUD requires us to look at before doing our final proposed activities. We have to determine if the activity is included in the list of eligible activities that I went through earlier, if the activity meets our consolidated goals and priorities for the 5-year period, also if it's going to meet one of those 3 national objectives that we talked about, and then also, as we talked about, that 70% of our funding has to benefit LMI people over a 3-year period, and also it has to meet whatever the performance measures requirements, our timeliness expenditure of money that has to be met. That's a requirement of HUD. So, what I'm showing you right now is our proposed for our CDBG program for 26-27. This is kind of what our budget looks like. And again, this is just proposed. It hasn't been finalized. And actually, we're using the funding that we got. We're projecting our 25-26 funding because we don't know what our 26-27 funding is going to be. So, we're projecting using our current funding dollars. So our actual allocation could come in higher or it could come in lower, and these projects will adjust accordingly. So we're outlining doing a home buyer assistance program where we can help first-time home buyers with down payment and closing cost assistance. We're also looking at creating a public facilities rehabilitation program for nonprofits in the community who own their own structures, who may need some rehab, like maybe they need handicap accessibility, maybe they need new furnace and water heaters, maybe it needs to be energy efficient, new roof, anything like that that can help nonprofits who help people who are homeless and people who are in substance abuse or other needs, make sure that their facilities are top notch and are in good repair to be able to bring projects for those categories. Also, we have a couple of properties that we are still maintaining as we're developing them in the future. And then we're hoping to also create some public infrastructure improvements in our low income census tracts. And so those are the projects right now that we're hoping to implement for proposing to implement. You get the opportunity to tell us what your thoughts are, if there's any other categories that we could be using the funds for that would meet those criteria that we talked about. So, also, what we're proposing for our home program is again, we're hoping to propose to use our single family new home construction out at the Baker subdivision. We still have several lots on the north side of the Baker subdivision that we're going to be wanting to build housing for both low income first time home buyers and also selling lots for market rate housing on the north side of the subdivision. And we'd like to finish that subdivision out to increase the supply of affordable housing while also selling lots for market rate housing in the subdivision. So, and remember, home funds can be, it's the only funds that could be used to actual do new home construction. So we'd like to propose to finish out that subdivision with utilizing our home funds for 26-27. So that's the end of the presentation about our proposed activities. You have the opportunity to give me feedback. You can send me an email at vanessa.bakerlatimer@cityofames.org. You can also give me a phone call at 515-239-5400 and give me feedback on the presentations. We're also going to be getting feedback through our council from our public forums that are happening that happened on Wednesday, March 25th, one at 11:30 to 1, and then one in the evening at 6 o'clock. If you didn't able to participate in that, this is an opportunity for you to give me feedback. Here's our timeline as well for the 26-27 action plan. Again, we had the public forums on March 25th. Also, we plan on having the public forum follow-up on April 14th with the City Council. You have the opportunity to come to that and give your feedback as well. If you didn't get a chance to email me or give me a call and share those with me, we're hoping to prepare the plan, but again, we cannot submit the plan until we actually know what our 26-27 allocation is going to be from HUD. Once we know that, we will create what we call our 30-day comment period, which we hope will happen sometime in June. Again, that depends on when we find out when our allocation is. Then we'll have a public hearing, hopefully sometime in July, and then submit the plan on or by August 16th of 2026. So that is our tentative timeline. So again, it's based on when we receive our dollars. But again, if you have any questions about this presentation, please don't hesitate to email me again at vanessa.bakerlatimer@cityofames.org or 515-239-5400. Give me a call. I'd love to hear back from you. Thank you again.